Hi, welcome to Lucy Talks, a safe space to talk. And today I have Dr. Valen, and I'll let him introduce himself.
Good. Hi, everybody. My name is Dr. Valen Sinisgalli. I'm a physical therapist, and I'm the CEO and founder of Reactivation Physical Therapy and Wellness.
What first drew you to therapy?
So actually, I ended up tearing my ACL in high school playing basketball. I ended up having a 75% partial tear, and then I underwent surgery, ACL reconstruction. And so that was my first exposure to physical therapy. And at the time, I was like, okay, this is cool. Nothing special. Later on, after my rehab, I ended up going to college and trying to figure out what I wanted to do. And then my econ professor at the time was like, "Hey, what do you want to do? Like, what are you trying to pursue?" And I'm like, I'm not sure. At the time, my major was physics. And obviously, I wasn't a physics major. I just liked the why behind everything and learning more about it. So that's kind of what drew me to it. But shortly after talking to him in his office hours, mid-semester, he's like, "Come back to me with 3 different potential professions that you want to go forth with." And I was like, okay. And so one was physical therapy, one was occupational therapy, and then I'm forgetting the last one, but it was more psychology related. I ended up picking physical therapy, and I ended up switching my major. I ended up going more kinesiology. At the time where I was at CSU Channel Islands, they didn't have it as a major. So the first step was to take anatomy and physiology. That's kind of the foundation of physical therapy. And so I ended up taking that at CSU Channel Islands for a whole year because it's a anatomy and then a physiology course. And so when I talked to the professor, she's like, "Hey, you should volunteer if that's what you want to do. See if you actually like it." So I ended up going to volunteer at the clinic I actually had my rehab at, and that's when I kind of found love. There's one story that sticks out to me. He was treating a patient, and he was telling me that this person was having blackouts at her desk, just sitting for long periods. And I'm like, "Oh, blackouts! Like that's very scary." And so he's like, she's been to 3 neurologists, and they couldn't figure it out. They didn't know why. So she ended up going to therapy. One of her doctors did it. I don't know if it was a primary or one of the neurologists, but he ended up concluding that it was more of her posture. Her head was just too far forward, and it was compressing the back of her neck, causing some reduction in blood flow to the brain and maybe some compression on the midbrain back there. And so she ended up blacking out. And so after seeing him, her blackouts started to reduce and kind of discontinue because she started working on her posture and improving everything. And I was like, wow, that's like life changing. And so
Yeah.
I was like, wow, I'm
Wow.
sold. I was like, to be that
So,
beneficial to someone's life and have that much
yeah,
benefit, yeah, that's what sold me.
that's crazy.
Yeah.
How old was this lady?
I don't know exactly, but she looked like she was maybe late 20s, early mid 30s.
Oh, that's young. Oh,
Yeah.
okay.
So yeah, it's just out of the ordinary. Like, I mean, it's not common to get blackouts.
But blackouts are when you just aren't responsive.
Well, like you just pass out and you
You
just kind
just
of lose
pass out. Oh, okay.
consciousness. And it's like, yeah, that's not something you normally get, like
Oh, yeah,
fainting.
that's not normal.
But yeah, his words were blackout at the time, but
Yeah.
fainting, same.
Yeah. Oh, okay.
Yeah, very scary.
Wow. What surprised you the most once you actually started studying or practicing physical therapy?
A lot of the stuff that I did learn in physical therapy was actually very similar to what I was doing in fitness before, kind of when I was at CSUN, learning all the stuff about exercise and fitness and whatnot. Just transferring to physical therapy, the biggest thing as I went into practice was more how insurance is pretty limiting. Where it's like, oh, okay, let me ask insurance how many sessions you have. Like, oh, I'm only going to give you 6 sessions. And it's like, okay, the body takes longer than that to heal and actually get better. And some people, they have life. They deal with kids. They deal with high stress levels from work and say they're injured and they're, oh my gosh, I can't pay the bills. So their stress is through the roof. And it's like, I only have 6 sessions to make you better. Like, there's no way. And so it was just a constant struggle to get people better because of all the kind of like, we're not in a sealed room where everything's perfect. Everything's super all over the place. People have lives to live, and it just wasn't cutting it. And then at the same time, I had to see 2, 3 patients at the same time. And it makes it even harder to focus on one person and actually get them to that end goal of actually getting back to what they need to do. Like say a police officer, for example, they need to be able to run when they need to run. They need to be able to jump. They need to be able to bring their arms out and shoot. Same thing with firefighters. They need to lift. They need to carry heavy gear all the time. Those are people that have specific expectations for their jobs, and say all of a sudden they're injured and they can barely lift 2 pounds. Like that's a big difference. So in order to get them to that end goal, it's going to take months. But in rehab, or the insurance is they only permit a certain amount of sessions, and then they say, nope, that's it. So it's like, why are they limiting us? And then the funny thing is the people who are actually looking after and overseeing the insurance of what gets approved or not are not actual physical therapists. Physical therapists review, but then who does it go to? A lot of times it goes to nurses who have no
who
background.
approves that? Like, that's horrible.
Yeah. So that's the system we're kind of screwed that way. So it's like, okay, why are people that are not in the same background as us reviewing it and making sure that it does go through or it doesn't. So it depends. But I do hear a lot of nurses, like case managers that oversee cases. And, it's like, hey, should they be reviewing our stuff and making that decision? Not likely.
So is that why you're not like at a hospital working? You just want to do it on your own?
Yeah.
So kind of avoiding all those kind of situations.
Yeah. It's a lot of limitations where it's like I'm trying my best to get people back to doing what they're doing and at the quickest possible. Because I know people have life to live. We only live so long. So the faster I can get you out of pain, the better. In terms of insurance, you have to see so many people and you have all these things you need to do in order to get them there. But it just ends not working out, not as good as could be. So I kind of opted out of insurance for that reason. There's just so many limiters, so many other things that were just out of my control that I'm like, hey, I can't get people better the way I want them to get better and as fast. So I opted out to do more the cash-based way, which is I don't take insurance, or there's an option to do a super bill where you can get reimbursed by your insurance, but it's kind of a headache for the most part, but that is an option. But yeah, going the cash-based route, I have the option to see people one-on-one, no time restraints. I don't have to worry about, oh my gosh, is my next patient here? Okay, you need to leave. Okay, I'm done. Nothing like that. There's no rushing or anything like that. There's no other aids either, where a lot of, in many outpatient clinics and insurance based, there's a lot of younger people running around that are aides that don't have any degree in physical therapy. They may have a bachelor's degree in kinesiology, but it's way different from exercise science to actual therapy. The reasons behind it, the way I was before, I knew a lot. I was like, but I know where I was at compared to what I am now as a doctor of physical therapy. The knowledge gap is just so vast. So it's like having the higher level of care, someone overlooking your program, managing you throughout the whole time you're with me is way better than seeing someone in insurance where you have to see multiple different clinicians at times. That prolongs your plan of care and it makes it so you have unclear guidance where you're like, hey, what am I supposed to do today? Do I progress? Do I just keep doing what I'm doing? And then a lot of times people just end up doing the same exercise, like the same like 5-6 exercises for like 2 months. And they know it. I've talked to other aides that have gone into PTs and they're like, yeah, when I was an aide in the past, like 3-4 years ago, I would just have them do the same exercises and say, here's your exercises. I'll see you in 20 minutes. And then they come back, okay, you're all done. And it's like, what kind of care is that?
Yeah.
Yeah. Quality care, not great. So that's why I opted out. That's one of the big reasons why.
I remember I went to physical therapy one time, and I have insurance. And I don't remember for what it was, but I remember it was like probably 15 minutes. And then that was it. It's like, go home. Here's a paper. Follow directions. And I'm like, what?
Yeah, that's
Okay.
it.
Okay. I was like, forget this. Like, I'm like, ugh. But I'm glad that there's people like you that actually take their time to help these people have a better life.
For sure. Yeah, I definitely, that's the model that I hear a lot where it's like, hey, I barely saw the therapist. I end up seeing this other person that I don't know what their credentials are. And they end up just saying, okay, well, I went and I didn't feel like therapy didn't work. So a lot of people actually have a bad experience in physical therapy for that reason, because that's not quality care. It's just like seeing a doctor for 5 minutes and then they're so busy because that's how the system is. It's not that they're bad therapists. It's the system that the medical field has provided that is not conducive to making sure people actually get better. It's actually keeping us sick. So that's why I opted out. I didn't want to be a part of that system. I actually want to get people better. So people who go through my program tend to have really good outcomes. Like 95% of them are like, okay, I barely have any pain. I know what to do to treat it. They're educated on what they have going on and they know exactly what to do to treat it because we went through the whole program. We found those things that work. It's all very specific per person. So it's not the same program for everybody.
Was there a patient earlier in your career that really changed how you think about healing?
Yeah. So there's a patient, right? I saw him a few times, but when I first met him, he was a little skeptical about meeting me. It was when I was only about 2 years out of school. And he's like, you look really young. And he's like, are you sure? Are you sure you're the one you're knowledgeable enough to treat me? And I was like, yeah.
The
And I was like,
audacity.
yeah. And I was like, oh, okay. I was like, hey, I look young, and I'm like, I'm not very old either. So it's like, if you have those questions, it's definitely a valid question. So I was like, I'll answer it to the best of my ability, and I'll tell you exactly how confident I feel treating the condition, and I'll leave it up to them. So I had a short conversation with him just about, actually, he was coming from out of surgery from having an artificial disc replacement in his back. And so I've only treated it maybe one time before then. But it was a guy who's really recurrent. I've already seen the other patient for like 3 months. It's a fairly newer surgery too, so it's not very common. It's coming more and more now as days go by, but with him, he was just the second person I've seen it with. And so I acted very confident. I was like, hey, this is what I can do for you. This is what it would be like. And he's like, yeah, he's like, my doctor wants me to do therapy, but I'm really scared and nervous. He's like, I just don't want to mess it up because I used to have really bad back pain. And I was like, yeah, I totally understand you there. So I told him and confirmed that, hey, this is what we're going to do. We're going to take it easy. We're going to go based on how you feel. And he was like, all right. And so right then and there, he's like, yep, let's schedule. So he felt confident with me. And from there, I ended up working with him for about 2-3 months after that for his low back. And just seeing how everything went. He had his ups and downs, just like normal in rehab. And just seeing how he responded to everything and how things went through, it kind of shifted my vision of like, okay, anxiety is going to be there no matter what. The way he healed was a lot better. He had some times where his pain was higher, and he's like, hey, I'm feeling this today. And he's like, can we do something else? So like just seeing that rehab is more of a roller coaster than anything else, and just listening to your body and going through the motions is kind of what we did, and it worked out. And I ended up seeing him for his neck like a couple years later, having another artificial disc replaced his neck 2 levels, and so that was very different from his low back, from what he was saying and how he recovered. And so seeing different spots of how healing is in the low back and the neck, usually you don't see it in the same person. It's not very common, but for him, I got to see that. And so that was very interesting how he went through the motions, but his neck took longer to heal than his low back. His neck might have been worse, more damaged to begin with. I'm not entirely sure. I don't recall all of his documents and whatnot, but it was really cool to see how he progressed and how the healing phases between different body parts worked out.
What's the biggest misconception people have about physical therapy?
So for this, I think a lot of people think that therapy is more for like post-op, like only people who just right out of surgery or have, really bad injuries. It's not always the case. That's kind of a lot of who we see. Yes, definitely correct. But we also see a lot of people that are more proactive in nature. Like say if you wanted to come see me, like, hey, I know my posture is bad. I sit a lot, those kind of people. It's like, I don't really have a whole lot of pain. It's just kind of there. And I just want to make sure it goes away so it doesn't get worse. And so being proactive is actually way better. It puts off a lot of problems before they even arise. And so if you already have the correct movement patterns with lifting, running, doing any type of exercise, your likelihood of getting injured is way less. Whereas like those who kind of just, oh, well, I didn't realize it was an issue, but it's better to not pretty much put it off, which is kind of what most people do because they don't see it as an issue. And so even the insurance is now they're trying to be more proactive of like, hey, do a physical. That's why they don't charge you. Same thing with dentists. They do cleanings, all proactive for preventative. And so why aren't we doing that in the physical therapy field? That's kind of the big question. It's just not something that the insurance pays for, at least right now. But being cash-based, I can offer that opportunity where it's like, hey, if you just want to get screened and just have me check out how you're moving, good. And then you can decide whether you want to continue or not. But at least you have that option. And so that's more of what things are going towards nowadays. There's also a big push in performance. As a physical therapist, we go through all the movements of the body. We're movement experts. We're the top of the food chain in that aspect. We know what we're talking about and we can treat it. So like we can watch you walk and see, okay, you have this, you have that, you have this going on. Not enough internal rotation of the hip, or you're rotating too much or not enough. Like we can see that just by how you move. So we don't need, sorry, I lost my train of thought. So yeah, so that's pretty much the basis of, what we can and can't do that a lot of people think it's just post-op, but we do a whole lot more.
Do most people come to you too late? What are the warnings and signs people tend to ignore?
So a lot of people tend to put off a lot of their injuries. Like, oh, I just got injured, but I'll be fine.
Like last minute kind of
Yeah.
thing.
Like, oh yeah, I'll be fine.
They'll go away with Tylenol.
100%. I just keep taking meds, whatever it may be. And I was like, I'm the same way initially. And thankfully I know what's going on in my body. I can feel, okay, what is that? And then I can do some tests to figure it out, but not everyone can do that. And so when people have those aches and pains, they either take pain meds or they just start doing stretching, or they just kind of suck it up and say, well, it is what it is. And so a lot of times it doesn't have to be that way. There's a lot of techniques and treatment that we have that we can actually treat it really quickly. So if I were to see you, say, 2 weeks after an injury, the likelihood of me treating that is pretty darn quick. I can get you out maybe in a session, and then that's it. Because if you're getting it early, the body's already in that healing phase, a lot of blood flow to the tissues, and then voila, easy fix. But if you wait, yeah, it's that
I never
crazy.
thought of that. That's so interesting.
It's just like a car, you let it keep running.
Yeah.
It'll break down some more. So the body's kind of similar in that fashion. I was like, but if you wait, the tough part about humans is that as it gets longer and longer, after 3 months, 6 months, a year, there's actually brain changes, brain chemistry changes that make it so you're kind of structured differently in the brain, where you just won't, the feedback that's going on from the brain, like say your foot hurts, the sensation traveling back up is not the same as it once was because the brain's interpreting it differently. And so we need to fix that. It's really hard to get people out of chronic pain. It's possible, but it just takes a lot more work and it takes longer to get it done. Whereas if you did it sooner than later, within the first 3 months or first 6 months, even, we can actually make significant change and actually get your pain down and actually get you moving and back to doing day-to-day stuff without any issues. So the sooner the better is really what it comes down to.
What's one thing most people are doing every day that hurt their bodies without realizing it?
It's what we're doing right now.
Sitting?
Sitting. Yep. Yeah, we do that way too much. And, there's research on how long, if you sit for too long, 11 hours is kind of that cutoff. Or if you sit longer than 11 hours in a day, your risk of mortality increases. So you're likely to die sooner.
People sit for 11 hours?
Yeah. Yeah. So imagine
You're
you sit for an
lying.
8-hour job. And so you may go to the restroom
Yeah.
maybe 2-3 times out of that, and you have a lunch. And what do we do when we eat? We sit most of the time. So it's like we're sitting maybe 6 to 7 hours in an 8-hour working shift if you work at a desk. And then say the commute to get to your job is an hour. Like a lot of people in California, they drive an hour to 2 hours to get to work, and then an hour, 2 hours to get back. So just by that, you're already at 11 hours.
Is there a patient story that has really stayed with you over the years?
He's a master's professor at a university at an engineering program. So super cool guy. Loved working with him. Just what happened to him is very unfortunate. He's also a test pilot as well. So he ended up getting ejected from a plane. Yeah, and I think the shield on top, I think he hit it, and so when he hit that shield on top as he needed to eject from the plane, he ended up getting a burst fracture at his L1 segment, and pretty much think of the bone just kind of obliterating, just going into 1,000 pieces, for example. I don't know.
Yeah.
That's kind of picture that I'm seeing in my mind when I hear burst fracture.
Yeah.
And so with that happening, he ended up having to undergo surgery. Surgery went well. He was having therapy, I think, for 3 months afterwards. Everything was going good. No pain, feeling great. And then this is a workers' comp case. All of a sudden, they cut him off. And they said, nope, no more. And he's like asking more like, hey, I'm not done with my rehab. I feel good, but I need to keep going. And so they just kind of ghosted him, so to speak, and just kind of waited and denied therapy for a long time. And they didn't give any other modalities either. So he was just on his own because they thought, okay, you're doing good. That's it. And so after that, he started going the other direction. His pain started getting worse. Things started hurting more. Couldn't do as much. When I ended up seeing him, I think it was like 2 years out afterwards. And so he was telling me that his pain is just like at the lowest it ever is a 3. But for the most part, he has like highs of like 8, 9, 10. And he's like having to talk to his class for like 2-3 hours. And he's like, it's better if I just stand and move around. If I stand in place, it's a lot worse. And he's like, after work, he's like, I'm just laying on my couch in my office and just laying there. And then he just randomly sleeps and people are like, hey, you okay? And so, yeah. So anytime I did stuff for him, I never saw him enough. So it's like they gave him 6 initially. And it's like, okay, we're getting some stuff. We have to find out what works for him, what doesn't. So a lot of the specificity of like, how are we going to get you to feel better and not do exercises that piss it off. And so as we went through, they gave him 6, didn't see him for 2 months, gave him 6, didn't see him for like 4 months. And it was like a whole year. So I only saw him 12 times like in a whole year. That's how much workers' comp does it and makes it so you actually don't reach your goals. Very frustrating. And it's very self-limiting for me. Like, hey, I want to help you as much as possible, but the system isn't letting me. Yeah. And so there was one point, thankfully, we ended up getting 18 sessions in one go because talked with his neurosurgeon and his case manager at the same time. And they happened to say, okay, good. You do need more therapy. Let's do it. So they approved it with those 18 sessions. We made so much progress. Wow. I got him down consistently to be at a 3 because that's the base pain that he has. And so he was there. He was able to do lunging. He was able to do lifting. He was able to do it all. And then didn't give him any more. Wow. Yeah. And so he was still continuing on with this stuff, but then it just kept getting progressively worse. So in this case, it might have just been things are getting worse in general, and he probably needs another surgery. So when I saw him again, I think a year later after not seeing him again, I saw him for like a one-off. He said, hey, the workers' comp case is closed. I need surgery on the other segment, L5, S1. He was bone on bone there as well. So I was kind of adding on to what he had. And so it was just making things way worse. So when I saw him, he's just like he's usually a very funny guy, easygoing, and he's usually always, even if he's in like 8, 9 out of 10 pain, he can make a joke. It's like now when I saw him after like a year after then, he couldn't make any jokes. He was like, yeah, he's like, I'm not in the mood. And he's just like, reduced voice, very antsy, doesn't want to move much. Did what I could to help him out. And his insurance at that point, they didn't want to do surgery for his back. They kept declining it. And so his neurosurgeon's like, he's like, hey, he's like, I'll do it for free if I don't really care. He's like, I know you need this. He's like, even though insurance won't cover it, he's like, what you can do is like, if you just want to go into the ER, with this high level of pain, is like, it's kind of like warranted that we need to see you and have you get surgery. And he's like, so at that point, the insurance will have to cover it. Just, it is what it is. And he just didn't want to go that way. He's like, I don't feel comfortable doing it. And so I was like, hey, it's your choice. So I haven't seen him since then or heard anything more about his story, but his story has kind of sat with me of like, wow, this is, a really hard case to even work with, because it's like I'm doing as much as I can, but sometimes it's out of my scope of practice. Someone else needs to take over, and it's more of a team effort. But in the medical field, like there's so much like limited communication where things actually we should be communicating, take the ego out of it. But it's just not how it works in the field. So it's unfortunate. I'd love to have communications with different doctors, but they're busy, we're busy. We just don't talk enough. And who gets affected? The patients.
Yeah. Have you ever seen someone recover from something doctors thought they wouldn't?
I believe so. So I have a cool story. It was another neurosurgeon. The surgeon ended up sending this patient to me. I've seen her in the past for other stuff. So I'm just like, hey, it's been like 6 months and all of a sudden she has something else going on. So I'm like, interesting. I don't know why these things keep happening to you, but the surgeon was saying that, hey, you need to have surgery at your C2-3 region because it's not in the right place and it's potentially compressing your spinal cord. And so it was like more of a preventative. They were going to do a fusion because it was more unstable. And so they gave her about 18 sessions just because insurance always requires PT before doing surgery. In most cases, sometimes this doesn't happen, but in this case it did. And so they're like, okay, once you do the therapy, kind of like a prehab aspect to prep the muscles, get you stronger, improves the outcomes post-op. So that's more of the reason behind it too. So it's two wins there. So the good news was I was able to strengthen the neck, reposition her posture in her neck, and I saved her from doing surgery. So even the surgeon's like, oh, she's like, oh, your neck's in a way better position. And he's like, hey, I don't think you need surgery anymore.
Whoa.
And so I was like, cool. So those are the cool things that we can do as physical therapists. We can get people out of surgery. And it's like, yes, sometimes surgery is warranted, but sometimes it can be prevented. And so more often than not, it can be prevented. And then sometimes it cannot. So it's just vice versa. It just depends. But if you have to put in the effort and the working and following a rehab progressive program to actually get you there, it is definitely possible if that's the route you want to take. It just depends on the patient. I was like, but with her, she was telling me, she's like, yeah, she's like, my neurosurgeon's impressed. He's like, he didn't think that was a thing. So I'm like, cool. So, and neurosurgeons are the top of the field of all surgeons. So it's a compliment to me for sure. I felt very
wow.
Grateful. Yeah, I was like, awesome. So, yeah.
They're like, can I talk to that physical therapist?
Yeah. I mean, I think I just got lucky with the patient and everything.
Like, let me have a conversation with you. What are you doing?
Yeah, it's like, wait a second.
Why are you taking my job?
No, not like that. I mean, can't overtake. Neurosurgeons are super smart, incredibly smart, very talented. And so I think I was just very lucky to be able to reposition her head, get her muscle stronger there. Yeah. And then, if it was something else, it might not have worked, but in her case, it did. So I was happy to save her from surgery.
If every listener did just one exercise every day, what would you recommend?
So I pondered this one because I was like, okay, what is the best exercise? I think that could be just generally for everybody. I would recommend single leg balance. So it's pretty much just standing on one leg. So this one helps your foot control. You'll be able to stand on one leg. You're using all your muscles on your feet. You're using your hips, your knees, you're pretty much your whole body to stand on one leg. And so we're also working the nervous system at the same time. So our balance is one thing that if you don't use it, you lose it. And you kind of notice no matter how hard you try with trying to maintain your balance, sometimes you just can't. So it's not like, hey, I'm going to lift this impossible heavy weight. Like, okay, you know your limits, but you're still able to do a lighter weight. With balance, you have to keep trying until you get better and better. So even the research you only have to do it one time a week in order to get some benefit from it. But what I like to do is I like to incorporate it in my day-to-day life. So whenever I'm brushing my teeth, I tend to try and stand on one leg and just the whole time I'm brushing my teeth, try to stand on one leg.
That's interesting.
Yeah. So that's something you can easily incorporate. And that's why I feel like it's the easiest thing. If you just incorporate little samples of exercise that just help your nervous system and your body stay healthy, it's much easier than, oh, okay, I need to go do a workout. Oh, I don't have time. I have to take care of the kids, or I have to do this. Then it just kind of gets lost. So, but yeah, if you incorporate it throughout the day, it's a lot easier. And same thing with that same balance exercise, you can progress it. You can do a single leg RDL. You can do rotation standing on one leg. You can do going side to side on one leg. So there's a lot of variations you can do to add on to it. And so it's just very crucial and important because we work on one leg a lot when we walk and we run. So
use it every day.
Yeah, exactly. So I feel like it's a multifaceted exercise that anyone could benefit from.
When should someone take pain seriously and see a professional?
Gotcha. So this one is a good one because a lot of people tend to just say, okay, I'm just going to deal with it. Typically, I like to say about a month after if things are that long. If you just want to wait, you just want to test it out and see how you feel. 2 weeks is also a good timeline where it's like, hey, is this pain persisting? Is it getting better or is it getting worse? A lot of times the pain does get better most of the time. And then people are like, okay, good. I'm in the clear. I'm getting better. All good signs. But sometimes it hits that point where it's like, okay, I don't really see much improvement, or now it's getting worse, or now I'm having flare-ups. And then it becomes a little bit unclear. So at that point, that's when people tend to take that step because they're like, okay, something's going on and it's not getting better. I keep feeling flare-ups or I keep getting worse on some days. I'm just not sure what to do next. So it's more that guidance aspect that people are looking for, but I always recommend sooner than later. So like if you're 2 weeks out from an injury or a month, that's probably the best time to get it checked out if things are not completely resolving. Because sometimes you can get injured for like, something happens, you get hit with something or you trip, you fall, and then you're okay, pain's there, but it's been a couple of days. If it doesn't go away within like 3 to 5 days, usually you have something else that's probably going to linger. And then if you're older, things just take longer in general to heal. And at that point, it's always good to get it checked out no matter what, because things can be long-term and never get better. And so, yeah, because at that point, everything's declining. All the tissues in your body are going the other direction. Whereas when we're younger, things are usually pretty good. You have a higher cell turnover rate, so you can heal faster and feel better quicker. So a month is kind of what I'm recommending. Probably the latest if things are bad, but a lot of people wait till longer. But the sooner the better.
Should people stretch every day? And if so, what's the right way to do it?
So with stretching, you can definitely stretch every day if you want. What I'm finding more clinically and as well as in research too is stretching isn't as good as we think. So at least in terms of benefits. So like there's better things than stretching. So you can stretch, trying to get mobility, definitely. Now things have been shifting more towards mobility training. Mm-hmm. So like I'm going to go through my full range of motion and pretty much load it to an extent. But a lot of times we want to use gravity. Like say if I'm doing an exercise on my hips where I'm trying to get my hip internal and external rotators to move, I'm going to start loading my hip and actively move through the full range of motion. And so that's where we're working the mobility at the end range of the joint throughout the full range of motion. That's more of what things are looking towards. And then there's also eccentric loading or lengthening that also has really good benefits for it. So like think of like a deadlift or a Romanian deadlift where we're doing the motions for the hamstrings. We're lengthening under load. That's going to tell the muscle to loosen up and it's going to get it stronger. So it's like a 2-for-1 special, I like to call it. And so those just are, I'm finding it better clinically and also in research is finding more effective than just doing static stretching, which is just holding and stretching a same position. Mm-hmm. So there's other techniques we can do that are like PNF or proprioceptive neuromuscular facilitation. Those ones are beneficial. I know there's a lot of stretch therapists out there learning more of that stuff and they can do it. But a lot of times people don't need to stretch. They need actually to get stronger. So that feeling of tightness is not really, oh, stretch me. It's actually strengthen me. So we're realizing that more and more now, and hopefully, as people listen to this, they can realize, okay, good. When I feel that tightness, it's not because I need to stretch. It's probably because that muscle's weak and it needs to get some stimulus, get some blood flow and some resistance training in it.
Why do so many people struggle with back pain today?
So it all comes down to the question we asked before, which was sitting. We all sit way too much.
Darn.
Yeah, it's like, dang. So yeah, sitting is kind of killing us in many ways. But yeah, people who sit, they tend to slouch. Their pelvis kind of gets in a tuck position, and then our hips kind of roll out, and then we kind of get stuck, and we feel stiff back there. So like low back pain, from what I'm seeing clinically, is actually more of a pelvic issue than a low back issue. So I like to frame it as like, okay, we have the foundation of a house. And if the foundation is crooked or it's not in the right position or it's not stable, everything above it isn't going to function correctly and work with sound structure either. So a lot of times with the pelvis, there's a lot of muscles that attach to it, all the muscles in the hips and the pelvis. And so we get excessive muscle imbalances. And again, muscle imbalances are normal, but when they become excessive and one's way tighter than the other or way weaker than the other, you tend to get some bones shifting out of place slightly, causing some compression in certain areas, usually the low back. And it just hurts. Uncomfortable. So like some people have pain at the center of the low back, which is a little bit more disc related. So disc herniations are pretty common. And then there's another condition that I typically see is called sacroiliac joint dysfunction, where the pelvis, again, is shifted out slightly, causing some pressure. And the pelvis can shift in several different planes. So it's my job to figure out, okay, what plane is it shifted in? How can I correct it? And actually put you back in the right position at that point in time. Most of the time, not everybody has this relief, but within sometimes as I correct it, maybe take a minute or two, and sometimes people have no pain after that. They go, oh, that was it. That's what I've been feeling. Other people, when they've had it for months and months and months, potentially even years, there's a lot of muscle imbalances that are there, whereas I correct it, but the muscle imbalances are so significant that like, oh, well, it helped a little bit, but I mainly feel this pain, or I feel this pain, and it's just different. And so it's not just one thing we're treating at that point. We're treating all these different muscles that are causing them pain, whether it's achy, sometimes sharp, maybe some tendon pain mixed in with that. So it can get really complex really fast when you start treating these things. So, but yeah, a lot of times people just sit way too much. So like a lot of the times people with sacroiliac joint dysfunction and that back pain, it's like caused by car accident. It's caused by sitting too much. It's caused by maybe stepping down a curb uncontrolled, or lifting while rotating, little things like that that are more common that I see. Yeah, that's one of the biggest reasons why. And then also the other comes down to chronic low back pain, where people just had injuries way in the past and it just never diagnosed correctly or treated correctly, and then it just lingers with them for the rest of their lives. And so a lot of the imaging that's out there, a lot of doctors are like, hey, you have this disc thing, you have this, you have degenerative disc disease, which is kind of everybody gets it naturally. So it's not a concern, but people tend to associate those labels with, oh my gosh, there's something wrong with me. And it's like, if we were to MRI everyone in the whole world, majority of the people would be asymptomatic, meaning no symptoms at all, but have disc herniations, or they have degenerative disc disease, but have no pain. The difference is how much do you move in a day, and what is your associating with pain? If you associate that thing with this kind of pain, your mindset behind it, and how you don't really understand how pain works, you're going to associate it negatively, and you're going to think of the pain. So this is where we change the brain chemistry, and we start thinking differently until we reframe it. And that's kind of part of why rehab takes so long with chronic pain patients, because we have to reframe how you see pain and tell you, okay, it's okay to do this, and you have to get in tune with your body. A lot of people just aren't in tune with what's going on, or really understand or know about it. So there's a lot of education we have to provide, and it's just a long process. So that's what I mentioned. If you could fix the issue earlier than later, do it. But again, not all therapy is the same. If you go to an insurance space and
they're not going to teach you to be in tune with your body whatsoever. They're going to be like, here's some medication, do this stretch, and you'll be good.
Yeah.
And it doesn't work that way.
No. So everyone needs more of a hands-on approach and more education as to why things work the way they work. And so I have time to do that. A lot of insurance spaces don't. Where they're like, hey, we can only see you for 30 minutes or 15 minutes, and then the aid's going to take you. And it's like the quality of care just isn't there. So like expecting people to get better from that, it's not realistic.
If someone listening is sitting right now, what's one small thing they can do to immediately help their body?
So if they're sitting, they can get up.
So dumb.
Yeah, they can get up. So
it's good. It's good.
Movement's key. So yeah, the more you move, the better you feel. So yeah, sitting for long periods, again, it's not good for you. So yeah,
your ass up.
Yeah, get up. Whoever's listening right now, stand up. Go for a quick walk. Take me with you. You can listen to me on the car or on the go.
Yeah. What part of your job makes you feel most fulfilled?
So I believe it's more of the client or patient communication that I have with people, and being able to see them progress throughout the whole plan of care. So like, say, if I were to see you, for example, say you had the same back pain we were talking about earlier. And so I have to go through all the processes of educating you on what's going on, telling you exactly what we're doing and why we're doing it, and then progressing you throughout the whole program. And so we'd be able to talk to you the whole time. I get to know you, you get to know me. And it's just more of a good process where it's like, hey, cool, I feel like I'm making all this progress. I'm having a good time doing it. Yes, it's hard. I'm pushing your boundaries, your limits, trying to figure out exactly how your pain is and how you're responding to it. And then it's just more so overall, your health is improving, and we're having a great time talking as well. So that's more the human connection that we all kind of strive for and need. And so that's more of what I enjoy about the process, and just seeing everybody get better and getting them back to that end result that they want. Say, I want to run a marathon, or I want to run a 5K, or I want to be able to lift and do a bench press of like 225 pounds, for example. Like those are the things that I want to get you back to doing.
What has the human body taught you about resilience?
I think we're pretty miraculous creatures, to be honest with you, where it's like, just seeing how people respond to therapy and seeing what they can do afterwards, where it's like, hey, just a couple months ago, you couldn't even walk, but now you're already jogging. Like, that's just insane. And it's like getting people out of surgery too, where it's like, hey, you had this tremendous injury in your spine that looked horrible in imaging, and now 2 months later, it looks great. The healing's there. You have more space in the joint. You have less pain. You can move. You have full range of motion. Before, you barely could move. Like, we are amazing how quick we can heal despite having all these injuries and potential surgeries that tend to happen to us. So yeah, we're pretty darn amazing. And that's what I tell people. It's like, hey, although you may think you'll never be able to, we need to have a positive mindset and say, yes, I can get there. I just need guidance. I need to follow and keep putting my next foot in front of the other and keep going in that direction. Wherever you want to go, you can get there if you put your mind to it and take the time to actually do it.
And if there's anyone out there that wants to contact you, how would they do it?
So they can contact me, or they can find me on Instagram at reactivationpt. My website, same thing, reactivationpt.com. And you can either text or call me at 661-231-4724.
Great. Well, thank you so much for sharing your story. And I hope people contact you to feel better for sure. And it was a pleasure seeing you. And toodaloo.